name is Megan. I'll be your student nurse today. Great. So I'm providing for privacy with that door. I'm gonna wash my hands. Can I get your name and date of birth, please? Awesome. I'm gonna check that wristband to confirm. Perfect. Then I'm gonna do my safety survey. So bed is locked and low. There's nothing on the ground to trip on. You have some shoes. All right. And then I'm gonna gather my supplies, which I have right here. Perfect. And then I am going to check provider order and review institutional policy. I would check if there's any meds to administer prior to the dressing change. And then I would teach my patient about what we're doing. So we're doing that wound dressing change to make sure we keep any infection out and minimize that pain and discomfort. And then I would ask them if they have any questions or concerns about the procedure today. And then I would assess their pain as well. So what is your pain like on a scale from 0 to 10, 0 being no pain, 10 being the worst pain you ever felt? Okay, awesome. And then I would assist them into a comfortable position. She's already laying down, so we're all good there. And then I'm good to start. So I'm gonna wash those hands again. Get some gloves on. Okay, then we're gonna take a look at that wound here. All right, so I'm gonna pull up the edges towards the center. I'm gonna pull that from the center. I'm gonna assess this for any drainage, odor, or the color of it. So there's no drainage here. If there was any drainage, I would look at the color. So if it was like green, it would be a purulent drainage, so that would indicate infection. I'm gonna discard that, and I'm gonna look at these gauze pieces as well once I take them out. I'm gonna also assess for drainage, odor, and color here. There's no drainage. And then I'm gonna look at my actual wound. So it is fairly deep. It's an abdomen wound, and it is beefy red in the inside. There's no drainage present, and then the peri-wound area is swollen and red. So that is actually a normal indication of wound healing, especially for something this big. But if it was infected, I would expect an odor. I would expect it to be a lot more swollen, maybe some like pus coming out. So it looks good for now though. And then I'm going to measure it as well. I'm gonna start with depth. Stick it in the inside, measure with my fingers. So wound is about 3 centimeters deep. I'm gonna discard that one. And I'm gonna use this to measure as well. Length of the wound is about 14 centimeters long and about 2.5 centimeters wide. And then we said depth was 3 centimeters deep. And now I'm going to change my gloves. And we're going to prepare our saline gauze to clean it. Make sure to use the center of the gauze pad to wipe. I'm going to go in straight first, as deep as I can, to wipe all of that out. Discard that. I'm going to get each side of the wound. Peri-wound area. Get this side. And one more. Awesome. And then I am going to discard those. Wash my hands. And we're gonna put some clean gauze in there to pack it because we do expect drainage from a wound this big. And if they had any medications, I would review my 3 checks and 11 rates as well. Okay, so I'm gonna pack it with 2 pieces of gauze since it is a larger wound. Okay. And then I'm gonna get a little pad on there. And get some tape. Okay, and then I'm going to change gloves, wash my hands, and then I'm gonna date, time, and initial this. So MB, it is the 13th of October, and it is 11:30. Awesome. Okay, and then I would assess my patient, make sure they're not in any pain or uncomfortable. I would document that I did my dressing change, and then I would thank my patient and leave. And I cover them up.